Now that you've had a chance to familiarize yourself with the new user interface and how to log into the system, let's take a look at one of the GI modules. I've gone ahead and accessed the basic polypectomy within lower GI procedures and have selected case number 1. I've had a chance to review the case history and have an understanding why this patient was referred to me. The next step is to go ahead and click Start Simulation. So let's do that. It's critical, again, as I pointed out earlier, to wait for the system to load and indicate that it's ready to receive the scope. This is how the system can break if not followed appropriately. So it's instructing me to please insert the scope to begin the procedure. So we'll go ahead and ensure that the dials are in the neutral position, meaning centered between right and left, up and down. And we can insert the scope into the lower GI entry plate, which is indicated with a rectal entry point. Now you'll notice on the screen the inside of the colon space, and using the different buttons that I pointed out earlier, I'm able to add insufflation or suction, and I can advance the scope. At the same time, I'm feeling force feedback within this system, which is representative of what I would feel if I was in a real clinical situation. Now, if I desire to select a specific tool, I'll have to go to the interface on the screen and the section labeled Accessories. So by clicking on Accessories, it will expand to show me any tools that are available to me. So let's go ahead and use the hot forceps. So I'll select the hot forceps by clicking on it, and now using the working channel tool, the filament that we looked at earlier, I'll proceed and insert it down the working channel until it comes into view. Now you can see it coming into view. I'll come in contact with the surrounding structure. I'll use the close button. You can now see it grabbing the structure, and if I pull on it, you can actually see some bleeding start to occur. Now I can withdraw my tool. I can reintroduce it if I want to take another sample, or I can go and choose from a different accessory from the menu. Once I feel like I've satisfied all the criteria of this module, I'll go ahead and remove my scope and then click Continue, either through the mouse interface or by pressing the C button on the keyboard. What I'll be presented with next are my results. This will benchmark my performance against the standards of the system and allow me to debrief with my faculty to understand where I may have some areas for improvement and what areas I've done quite well. This will be stored in the system as part of my student record, and for research purposes may be exported along with a number of other students for general research projects and performance review for class or segments of the residency program. Now, if I went ahead and I advanced to some of the other procedures within the system, you'll notice there's additional buttons that are available. So if we took a look at the EBIS TBNA bronchoscopy procedure as one example, you'll notice there's buttons that include instructions. This will tell you more about how to use the accessory device like the EBIS TBNA needle accessory, which is a little bit more technically challenging to operate. It'll offer any demo videos that have been preloaded within the system. You'll still have your case history and your pre-procedures, but you'll now have access to a button that's labeled Parameters. By clicking on the Parameters button, you'll be able to see what conditions have been established by your faculty. The administrator, the faculty, or the training center manager does have the ability to enter the system and to make adjustments to these settings and then save it under different names. This will allow you to customize the parameters based on the student's level and even within segments within the same level. So for example, you may allow a first-year resident to take 10 minutes to do a procedure, but you may have a segment within that first-year population who are a little bit more technically advanced, and you may want to complete it within 8 minutes. Different versions can be saved for different levels of technical and cognitive ability. Now that we've had a chance to look at the GI procedures together, let's take a minute to look at our EBIS TBNA module, our most popular module, as well as one that has had multiple studies performed on it that have been published in peer-reviewed journals. Again, something else to mention to your prospective clients. They'll find it tremendously interesting and valuable. I've gone ahead and connected the bronchoscope to the rear of the system using the Quick Connect adapter. I've also connected our EBIS TBNA needle also to the rear of the haptic cart just above where the Quick Connect placement is. I've taken the liberty of choosing case number 1, clicking Start Simulation, having reviewed the different demo videos, the case history, and the pre-procedure information. What you'll notice here on my screen in the upper left quadrant is going to be my scope tip view. As is found in the real clinical procedure, there is a camera outfitted at the tip of the scope, and by flexing the adjustment lever on the back of the scope, it'll allow me to electronically elevate the tip of the scope in order to navigate within the system. In the lower left quadrant, you'll notice our CT deck. This enables the operator to flip through a series of CT slides in order to take a better look at where there might be a mass that they want to take a sample of within the bronchial tree. In the main section of the screen, you'll notice the ultrasound view. And what's very unique about the EBIS TBNA module is that from the administrator login, you can customize the look of the screen. So you can move panels from one section to the other before you start the simulation, or by clicking on the arrows on the screen once you started your simulation, you can do the same thing. You'll also notice different medications. So there's different links for topicals, IV medications, and oxygen, and by clicking on any given one of them, we'll expand the menu to show you which drugs are available for application. On the right-hand side of the left monitor, you'll also notice video gallery. You have the ability to capture video sequences and then play them back. You can take still images in the still gallery. All of these are controlled from the buttons on the bronchoscope. Again, these can be customized by the administrator according to the institution's equipment preferences in order to have it replicate as close as possible the system setup that they have in their bronch suite. You'll also have the ultrasound controls. While you can turn it on from the scope itself, you have the same controls through the interface. You can inflate the balloon and deflate the balloon, stabilize the scope, which will be key when performing the transbronchial needle aspiration. You can take depth measurements, use power Doppler, as well as label structures, which is a really nice teaching enhancement that's very important to point out to your prospective clients. And you can freeze and record video like I mentioned earlier. So let's go ahead and introduce the scope. Again, always make sure that the screen tells you it's ready to accept the scope. You have the appropriate faceplate loaded as well in the system. In this case, the oral anatomy plate for the bronch. We'll go ahead and place the scope into the patient's mouth, and you'll start to see in the upper left quadrant the scope advancing past the tonsils, the tongue, and now the vocal cords. Now, once I'm in my desired area and I've turned on my ultrasound, as you can see here in the middle of the screen, I can start to see the different structures using the label structures teaching aid. I can go ahead and use Doppler if I wanted to see if there was any blood flow in a specific region, indicated in different intensities of orange. And again, I can stabilize the scope, which will use a mechanical joint inside the haptic cart that'll freeze the scope. Now it'll free up my right hand if I need to attach the needle accessory. If we want to go ahead and attach the needle accessory, what I'll have to do is first begin by ensuring that my locking mechanisms are extended to their farthest ends. I'll then go ahead and take the filament cable and introduce it into the working channel. A message will appear on the screen, as you can now see, just verifying that you have separated the hubs or the locking mechanisms so that they're at their farthest points. You'll click OK, and now you're ready to proceed with the needle. Now, once the needle starts to get descended into view, you'll notice a white artifact in the ultrasound view as well as in the scope view. So let's take a look first at the scope view by lowering the needle. Now you can see it extending into view here. We'll go ahead and poke the side wall so you can see the blood artifacts that occur when this comes in contact with the structure. So now I've poked the wall, and you can see some bleeding occurring. In the ultrasound view, you'll see it come in from the upper right towards the lower left. So you can see the white shadow coming into view as indicated and labeled as needle. Now that I have connected the needle to the working channel, I also have a new set of interface options that will become available to me. These include removing or inserting the stylet, jiggling the stylet, attaching a syringe, creating suction, and then turning suction off. These are all essential in the steps of performing EBUS TBNA, and the instructions on how to properly perform this technique can be found prior to clicking Start Simulation. Once I'm finished, I'll release my lock and remove my needle. And as is found in all the other modules, I'll remove my scope, first by unlocking the stabilized scope and clicking End Simulation. I'll be presented with my performance results, indicating whether I located the appropriate node, the various performance metrics that relate to it, and then different aspects of the procedure and the technique, all of which can be exported for future analysis or research purposes. And that concludes the presentation of a bronchoscopy procedure on the EndoVR simulator. Having now reviewed the end user interface and how to start a given case, let's take a minute to look at the administrative features. Some of these are very unique to the EndoVR system and should be pointed out to your prospective clients as they will be of tremendous interest. Some of these features include the ability to upload didactic videos or multimedia content, create users in groups, curriculum, whether in an optional sequence or a mandatory linear sequence. So moving along, I've taken the liberty of selecting the EBUS TBNA Case 1 and clicked on Edit Parameters. As I'd alluded to earlier, this will enable their faculty to customize each case to suit different target audiences. They can save them under different names and edit these parameters to make sure that they're really suitable for their audience. What I've done here now, after choosing case number 1 and clicking on Edit Parameters, I can drag the different sliders to adjust different elements of the case. And the students will be benchmarked against these parameters. Once I'm done, I can click on Save Changes, and I'll have the ability to save it under different names to make sure that I have variations that I can quickly locate and assign to different users. Now, having reviewed just a few elements of the administration portion of the EndoVR, it's important for you to go back and review the user manual and spend some time on the system. While I've mentioned certain topics that are available through the administration interface, such as editing parameters, there are many other features and facets to the administration function that are important to learn and to point out to your clients. So just make sure you spend the time to learn it. You'll be happy you did in the end. Now that we've had a chance to review the different cases and pathologies within the EndoVR simulator for upper and lower GI as well as bronchoscopy, as well as the administration features within the EndoVR, let's recap. What would you say to your client the first time you speak to them? First, point out the fact that the system can be elevated or lowered to accommodate the operator's height. Don't short-sight this. This can be quite important to them. In the real clinical setting, they can raise the patient bed up or down, and we've replicated that within the simulation. Second, highlight the fact that they can export student data. This is key within research environments. Most doctors within university settings have the desire to publish. It helps them further their career. So promoting the fact that they can export data can be very beneficial to them when looking at new research topics. The third aspect is the administration parameter adjustments. This allows the administrator or faculty to create a plethora of cases for all their different student levels. They can create one case or tweak slight variations within the parameters to create a multitude of them. And that summarizes the highlights of the EndoVR surgical simulator platform. Now that you've become more familiar with the system, you're going to be looking for areas to prospect. So, which institutions do you choose to approach? First, you're going to start with university health centers. Next, you may want to move on to affiliated health centers. These are hospitals that may be located outside of urban centers but have residents affiliated with the main universities circulating through to gain additional clinical exposure. You may have medical associations, societies, and the like also within your region that could have a possible interest in these systems, as we found in North America and in other countries. Now that you've identified the geographic location and centers, which departments do you approach? There are a number of departments that have a vested interest in such a system. They include gastrointestinal or gastroenterology, internal medicine, anesthesiology, bronchoscopists, pulmonologists, and the like. All of these should be considered as there are different procedures and modules contained within the system that will be of interest to them. Next, I'm going to discuss a little bit more around FES and SAGES. This may be new nomenclature to you, but it's very important, as when you try to position this system to the general surgeons in particular, you may get some feedback and some objections that you need to be aware of. So what is FES? FES stands for the Fundamentals of Endoscopic Surgery. Similar to FLS on the laparoscopic surgery side, FES has been established by SAGES, a world-leading organization of general surgeons. Because general surgeons do perform upper endoscopy and lower endoscopy, they had a vested interest in forming the basics of the fundamental skills that are required to become a competent endoscopist. Unfortunately, this was developed in conjunction through one of our competitors with SAGES. We do not offer those modules as part of our feature set. However, many of the same skills can be practiced on our simulation platform. When positioning the EndoVR to possible clients, it's always valuable to mention that there is a number of studies that have been published on the EndoVR and its utility in helping shorten the learning curve. There have been different studies that focus on the bronchoscopy modules and other ones that focus more on the upper or lower GI sections. As you become more comfortable with the EndoVR system, you may have some additional questions. Don't be afraid to consult the quick reference guide, the case descriptions, and the user manual. Should you have questions that you can't find answers to in these documents, feel free to send them to your regional sales